We now move on to the next event, the inauguration. The galaxy of intellectuals, honorable guests, benevolent teachers, and beloved delegates. A very good afternoon to all of you. It is my great pleasure to welcome you all to the inauguration ceremony of the 10th AOGIN India Conference 2021. The theme of the conference is Elimination of Cervical Cancer from Research to Practice. I take this opportunity to invite our chief guest, Dr. V.K. Paul, member Niti Aayog, guests of honor, Sri Rajiv Gaba, Cabinet Secretary of India, and Dr. Sunil Kumar, Director General of Health Services, Government of India. I do invite Dr. Randeep Guleria, Director AIMS, New Delhi, Dr. Sabita Gupta, President of AOGIN India, Dr. Lata Balasubramani, Secretary, AOGIN India, Dr. Neerja Batla, Organizing Chairperson of the conference, and Dr. Seema Singhal, the Organizing Secretary. No program is complete without seeking blessings from the Almighty, and we shall commence the inauguration with lamp lighting and Saraswati Vandana. I request all the dignitaries for lamp lighting.
For our organization is to reduce the burden of diseases caused by reproductive tract infections, especially HPV. And our mission is to work with governmental organizations, NGOs, learned societies, healthcare workers, and lay public working towards prevention, early detection, and management of cervical and other genital cancers. In lieu of the national conference, which we were unable to do last year, we had an academic session. And this, as the organization promotes research, this was geared towards research methodology to ensure that our youngsters learn the basics of research. And there was also a focus on clinical practice lecture series. There were 7 lectures, 2 case-based discussions, and 2 paramedical webinars, which was attended by more than 500 delegates from ASHA workers, so that this information regarding cervical cancer goes not just to the medical fraternity, but goes down to the paramedical workers as well. COVID kept us in, but it did not keep us down. So we ended up these academic sessions with fun and frolic, which I think was a good relief for all our members as well. November 17, 2020 was D-Day, when the WHO called for elimination of cervical cancer. Our members helped by putting up awareness talks. We had buildings lighted up in teal and to promote awareness within their respective communities. Our newsletter brings to our members what is the latest in research that is going across all over the world. It brings us snippets of clinical information on how best to treat our patients as well. We have a very active, interactive website that has teaching resources, which is of great help to our members. And November 17, 2021, we had a spontaneous response to our call to create awareness. And we had well-known buildings all across the country lighted up to ensure that there was awareness in the community and the country. The WHO had requested all its states to take a pledge towards working towards elimination of cervical cancer. And this was done with great enthusiasm amongst all our members. One of the more recent is our collaboration with the International Papilloma Virus Society. And for the next year, 2022, they have come up with a slogan of one less worry. So amid so many worries, we have to take it. Let us have one less worry by working towards either vaccination for our adolescents or screening for our women. So we also fund community screening activities, we fund travel grants, and we are currently working on creating a public movement for advocacy involving governmental organizations, medical organizations, teachers, Rotary, Lions, Roundtable, pharma, NGOs, and educational institutions. We've had a wonderful start to our conference. We've had workshops yesterday. We've had deliberations of the highest scientific caliber in the ongoing annual conference, and I'm sure This will help in policy decisions and will also be incorporated in our clinical practice. Thank you very much.
Thank you, Dr. Lata Madam, for letting us know about the progress of AOGIN India. I would now invite our guest of honor, Dr. Sunil Kumar, Director General of Health Services, Government of India, to enlighten us with his words of wisdom.
Friends, I am delighted to address the Assembly here for the 10th National Conference of AOGIN India. The theme of this year's Congress is Eliminating Cervical Cancer from Research to Practice. It is gratifying to know that AOGIN India has been striving towards elimination of cervical cancer from India. As you know, cervical cancer is the second most common cancer affecting Indian women. The incidence and mortality of this disease is a reflection of the available resources and the medical infrastructure for population-wide screening and treatment. Implementation of cervical cancer prevention programs, that is, the screening linked with treatment of precancers and HPV vaccination, can lead to significant reduction in incidence and mortality to a level where it will no longer be a public health problem. A research project by IARC in Tamil Nadu and TMC Mumbai have shown that even 1 to 2 rounds of screening by simple methods of VIA could lead to reduction in the incidence and mortality due to cervical cancer. This led to the development of state-wide program in Tamil Nadu. In 2016, the Honorable PM announced a call for nationwide screening for 3 cancers: breast, oral and cervical. And within 3 months, the Ministry of Health and Family Welfare prepared the operational guidelines. The NPCDCS, that means the National Program for Prevention and Control of Cancer, Diabetes, Cardiovascular Diseases and Stroke guidelines, have adopted VIA as the test of choice, with 5 yearly screening among women aged 30 to 65. The program has been rolled out already in more than 300 districts. Although we need to do a lot more efforts for training, setting up linkage for treatment and follow-up, and also in record keeping, etc. The launch of global strategies for elimination of cervical cancer as a public health problem by WHO was a landmark event last year, and India is signatory to this declaration. WHO recommends screening at 2 time points in women's life with an effective test like HPV test at the age of 35 years and again by age of 45 years. While we see the merits of this approach, presently there are logistic challenges in India. The cost of tests, setting up of laboratories, transporting samples, communicating reports, etc. A Make in India effort is urgently required to make HPV testing affordable, point of care and widely available for not only in India but also for all LMICs. But HPV testing will still require triage either by VIA or by colposcopy. Newer technologies like battery operated affordable portable devices for screening will help us reach primary facilities. There are already some indigenous efforts in this direction, and we welcome more of such developments. Reaching the rural areas where the incidence is very high or can be said to be the highest, and where the majority of the women are socio-economically disadvantaged with no formal education and no awareness of the risk factor associated with the development of the disease. This is our top priority. Implementation of any program is always a challenge. The healthcare workers need to be trained and retrained to implement these screening programs at the grassroots level. There is a dire need to raise awareness about the preventive strategies amongst the general population. So I am glad that the healthcare professionals from the last mile facilities like nurses, ANMs and ASHA workers are being involved in the community screening workshop. Ministry of Health and Family Welfare also emphasizes upon a multidisciplinary approach to cancer treatment and its availability at all regional cancer centers. Under the Pradhan Mantri Jan Arogya Yojana, treatment for cancer is made accessible to economically weaker sections and underprivileged women. The establishment of a national cervical cancer screening register is also an emerging need of the nation. Provisions of an electronic infrastructure for collection, storage, analysis, and reporting of the screening program data and the linkage of the screening registries with the cancer registries are the goals for our future. It will help to generate comprehensive data to inform policy and improve program quality and service delivery. Healthcare providers may get better access to quality health information with the help of these registry. The conference program brings together stalwarts from all over the world working in the field of gynecological cancers and preventive oncology to share their knowledge and experiences to transform research into practice. I am looking forward to implementable solutions to make cervical cancer a story of the past, and I am sure of your support for this noble cause, as is from our side too. Thank you very much. Jai Hind, Jai Bharat. Friends, I am delighted to
Thank you, sir, for the promising words. I now request our guest of honor, Sri Rajiv Baba, sir, Cabinet Secretary of India, to address this August